treatment room, clean my hands, and then I have my mar here, and I'm gonna take off the medication of the drawer. So I have Fruarex Quadrivalent 0.5 ml. So I got it here. I have the right stuff I need. I have the syringe, and then I have alcohol wipes. I have everything. So checking my first check-in, I checked the medication and take it out, and then I'm going to clean my vial. My hands again. Okay, before I drop the medication, I'm gonna check my MAR again. So it says 0.5 ml for my flu shot. So I'm gonna check again what I have is the right one. Then my gloves, put on gloves. Okay, then I'm gonna drop 0.5 air. And then I will inject this. And then withdraw 0.5 ml of Fruarex Quadrivalent. I'll make sure I am bubble free. Okay. Trying to get rid of the bubble. Here we are. And then I'm gonna check in with the 0.5 ml without any bubbles. And then I'll cup it again. And then I'll take off my gloves. I checked my MAR again for my second check. I have the right dose, the right medication, and then I have the right patient. Of course, it's the right dose, and I'm administering at the right time and the right route, which is intramuscular. So I'm gonna go in and get ready with my patient whom I'm gonna give injection. So I'm gonna clean up my hands quick. I just did. So knock knock. Hi, my name is Yvonne. I'm gonna be a nurse today. I'm gonna give you your flu shot today. So how are you doing today?
I'm doing okay, just tired.
You're tired? Oh, okay. So I'm gonna give you a flu shot like I just told you, but I wanna know if you have any allergies to it. No, is that okay with you to give it to you? Okay, I have like 4 sites that I give injection. I am on intramuscular injection too. So I'm gonna give it one site. I'm gonna use it to you, but I'm gonna demonstrate or demo 4 parts I would do. Is that okay with you?
Yeah, that's okay.
Okay, I'm gonna hold you sit up first for me. So, will you give me your number, your name, and your date of birth?
Janice, 1906.
Okay, I'm gonna check your wristband too and check if the right name. Okay, I'm gonna check my first side. Just relax down here. So I'm gonna check my deltoid side. So I'm gonna check your chromium process up here, your bony part. Then I'm gonna go 2 to 3 fingers down, and then I'll have a triangle right beneath it, and then I'll go in the middle of my V, and I'm gonna make sure I'm just injecting to the muscle, just make sure that it's soft. It's a muscle, it has to be soft, of course. Okay, thank you. So you're gonna lay down. My second injection is gonna be my ventral gluteus. So I'm gonna have you lay facing me, and then I am going to look at the greater trochanter, and I put my palm here on it, on greater trochanter, and I make sure I touch with my point finger on your anterior superior iliac spine, with my thumb facing your pubis, and then with my middle finger facing your iliac crest. And then I'll give you injection right on the bottom of my V, or on the bottom of my middle finger. Okay, you want to turn around on the other way? Go for my next injection site. It's gonna be my dorsal gluteus. So I'm gonna have one point finger on your greater trochanter, and the other finger is gonna be on my superior, it's gonna be my posterior superior iliac spine, and then I'm gonna draw a imaginary line between them, and then where they meet, it's gonna be in the midway. I'm gonna go on 1 inch up, and then I'm gonna make sure it's the muscle, so it's smooth. So I give you injection over there. Okay, so you wanna come this way? Okay, I'm gonna go for the third side, which is gonna be my rectus femoris. It's gonna be I'm gonna put my first hand just below the symphysis pubis, and then the other one is gonna be above your patella. And then I'm gonna have my thumbs like a 90-degree angle, and then have my fingers like trying to cross, and where they meet, that's where I'm gonna give your IM injection, which is the rectus femoris. If I was to give it to an infant, I'll go right down on the bed, and then I'll form like 45-degree angle, and then where they meet my point fingers, that's where I will give you an infant injection, but you're not an infant. All right, thank you. I'm gonna go ahead and get your flu shot ready. Okay, I'm gonna clean my hands again. Again, I'm gonna do my third check. You wanna tell me your name and your date of birth again?
January 1906.
Thank you. And I'm gonna check your wristband again, and I'm gonna have gloves on. And I'm gonna clean my muscle quick. 30 seconds circular motion, 30 seconds. And I'm okay. Right after I ask her name and her date of birth, I check with my MAR, and again I check with my maid that it's the right patient I'm gonna give it to, and then I'm gonna toss this in the garbage. And I'm gonna use the Z-Track technique, and I'm gonna go 9-degree angle. Check the peak. And then I will use safety method, and then I will charge this in a sharp container. And then I take off my gloves. Wash my hands. And then I come back to my patient. Do you need anything? Do you have any question? Or all? Here's your call. Let me know if you need anything. Okay, then more privacy, and then go clean up with my stuff. Back to the bedroom, and then I will go document what I just did. So those are